I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk a little bit today about surgery prep for rotator cuff surgery or labral repair, also known as shoulder surgery. The first thing is, if you are a smoker, please stop smoking. The first 6 weeks after shoulder surgery are critical to get either the rotator cuff tendon to heal to the bone or the labrum to heal back to the bone. The nicotine in the cigarette smoke causes vasoconstriction, which means it causes the blood vessels to get really, really narrow. Doesn't allow good blood flow to the shoulder, which can actually allow the rotator cuff repair not to work. It just won't heal. So for at least the first 6 weeks right after surgery, please stop smoking. Every cigarette less you smoke is something you can do to help heal your repair. Number 2, the night before you will be given instructions from my office to clean the shoulder if you're having left shoulder surgery with an antibacterial soap. That will help to reduce the amount of bacteria that normally lives on our skin, lowering your risk of infection. Number 3, we'll have you come to our office probably a couple days before the surgery to pick up all your shoulder accessories. The first thing you'll need is your shoulder sling. You'll be wearing this anywhere between 3 to 6 weeks after surgery, sometimes longer based on the size of the repair and the quality of the rotator cuff. This will become your new buddy. The second thing you will get, which most insurance companies don't pay for, but it's something that we highly recommend as a cash product. It's a cold unit. It will pump cold water through this hose that is connected to a wrap that goes around your shoulder, and it gives you 9 hours worth of ice cold therapy to the shoulder. And then we just recommend you use this literally around the clock. I found this personally to work great. I had elbow surgery, and this was a lifesaver. It helped to cut down the amount of pain medication. It helped me sleep better, and you can literally just plug it into the wall, hook it up to your shoulder, and for 9 hours you'll have good cold therapy. The next thing you'll be given from my office is discharge orders the day of surgery. They will give you detailed instructions about how to change the dressing, when to start certain activities. It will also give you 2 videos that you can go to on my YouTube channel through my practice that will talk about some exercises that you can start doing right away after your shoulder surgery. And last but not least, remember to be NPO after midnight, which means nothing to eat or drink after midnight. Thank you.